Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
Welcome back to Health Matters. On today's edition, I'm sitting down with Dr. Tamer Elsayed, who is an associate professor and chair of family medicine at the College of Community Health Sciences. Thank you for being here, Dr.
Thank you,
Elsayed.
Ashley, for inviting me.
Yes. So today we're going to talk a little bit about AI and its application in medicine. Can you just briefly talk about how is it currently being used today?
Absolutely. It's AI have been one of the most evolving spaces in medicine, and there is a lot of utility in it right now. I think one of the biggest thing is it's used to decrease doctor's time in documentation and help us focus more on patients rather than anything else. One of the practical things that we're using right now is ambient scribes, where we kind of, when we go into the room with the patient, we're focusing on the patient while the computer and the AI is really writing the whole discussion and making documentation. So it gives me a chance to really focus more on the patient. One of the other really advanced uses of AI now is in imaging. So a lot of the radiologists now use AI to augment their diagnosis. It helps a lot in early detection of cancer, in CT scans, in X-rays, and ultrasounds. It also helps in preventative medicine, so it can alert a doctor on, hey, this patient needs a colonoscopy, this patient is missing his mammogram every year, for a year now. So it can have a lot of implications in preventative care as well.
So if AI makes a mistake, because after all it is technology and technology makes mistakes, who do we blame?
Well, absolutely. That's a very good question. So some people think AI is a robot. I think it's more of a smart assistant. It helps the doctors more doing their work. The full responsibility is on the doctor. So AI just helps us in the team. We have to review everything AI advises on. We make our judgment based on experience, knowledge, and use it in that way. I think that AI will help in speeding up things for patients, but rather than it is a responsibility of the doctor, absolutely.
There are a lot of online research and surveys that talk about patients being semi-uncomfortable with AI use. What do you say to those patients who are a little bit worried about the relationship between doctors and AI?
Absolutely. I would tell them to ask their doctor more questions about AI and how the doctors are using AI, how it helps in making the decision. One of the most important part of it actually is that doctors need to educate patients about the use of AI and how they are using it and get their consent first before they use AI. So I think it's a mutual discussion, how can it benefit me? I see patients right now actually going into the internet and AI, asking AI questions before they see the doctors and come prepared and have a list of questions. So it's actually helping patients and educating them in the right questions to ask doctors as well.
So do you think that there's a risk in overtrusting AI? Like, what's the balance between doctor and artificial intelligence?
Absolutely. I think there is a risk in trusting. You cannot trust it. You can say this, trust and verify. So I think you can trust it to a certain extent, but every time you look information in AI, you have to verify it with solid medical resources like guidelines, society guidelines, papers, articles, to make sure that you are doing the right thing with the patient.
Do you think that a lot of patients are worried that we're lacking that human connection? Do you think that that's helping with that, or do you think that there's a different way that we can use it to aid in that?
I think it's helping in a way, as I mentioned earlier, with ambient scribing, you're really focusing on the patient. You're not worried anymore on documenting the encounter or the visit with the patient. You're looking at the patient. You're having more time to discuss important matters with the patient. And I think that helps build the relation and rapport and the trust with the patient. I think being transparent on how we use it and informing the patient ahead of time will build that relation and get a lot of benefit for the patients. Absolutely.
So what do you think the future will look like? Let's say 50 years as technology continues to progress. What do you think?
I think 5 years. I think it's progressing very fast. Wow. I think a lot of things are happening in research as well. So advances in developing medicines is really taking off very fast. So developing medicine, instead of taking 5 years, it's taking 1 or 2 years now with the use of tools of AI. and getting data about patients and having larger studies on larger number of patients to get better results. So I think it's expanding very quickly. I think that patients will value it, will learn about it, and doctors also will value it, learn about it. It's not gonna, I don't think it's ever gonna trump the trust between the patient and the doctor, or the experience, or the clinical judgment. I think physicians will have to continue to train to see patient, to do a physical exam. I will never do a physical exam. Also ask the right question and build about experience for many years. I think AI will help make the accuracy of medicine, early diagnosis, prevention is going to be a big deal, treating cancer early. So there's a lot of potential advances. I think in the future, patients will start using AI directly to guide them when to go to the emergency room, when to go to the doctor, when to take medication over the counter. Still, there should be human oversight for that use.
So you talk about how AI can aid in cancer diagnosis. Can you go a little bit deeper into how that might work?
So two ways. In imaging, you can have early detection of cancer when the radiologists use AI based on a large number of data that they have, previous scans, so they can easily and early detect cancer, and this allows for early intervention and prevention of spread. The other part is also in the prevention part, which I think is very important, even more important. The AI tools now can scan the patient's chart and can go back in history on all of the available information and say, okay, this patient needed a mammogram, or this patient needed a colonoscopy, or he's due for a DEXA scan. So all of the preventative medicine can now come to the doctor in every visit, alerting him on, hey, your patient needs these things. Don't forget to do these things, so preventing disease development in the first place.
And overall, how relevant is it? How prevalent is it being used today? How often are you seeing it?
I think in the daily use, of course, in charting and in documentation, it's used daily now. In a lot of practice, we actually in CCHS will be piloting it in January with some of our patients to see how it's used, and hopefully by the end of the year, all our providers will be using it safely, of course, with privacy and HIPAA constraints, and ethical use of it is very important. How it's used right now, I think the alerts that come in the EMR are one of the biggest ones for the physicians. It's also used in certain practices, early use in scheduling and access to patients. So AI can look at the whole practice schedule, see where the spots are open, and when patient calls for an appointment, they can give them the earliest appointment available. And this way you avoid the patients having to go to the ER or urgent care and come to you to the practice and see the doctor. So I think these are very promising early use of AI.
So it's saving a lot of time, it sounds like.
Absolutely.
Is it being regulated right now? And if not, do you think it needs to be regulated?
I think there is not, there is no regulations that is prevalent right now. I think every organization is trying to regulate it. The biggest things are HIPAA for medicine, is HIPAA, privacy, and security. I think these are the three biggest things that we are focusing now, and every time we try to deploy a tool in AI in medicine, we discuss it with the HIPAA officer, with the privacy officer, with security, to make sure there is no breaches in patient data, there is no compromise in the patient charts, and that we are using it in an ethical way. So I think regulations are going to come. I think it's upon us doctors to actually regulate it ourselves. So this part, actually, we use it in education. Now, a lot of students, residents are using AI, things like open evidence, to ask questions and get answers. So us as educators, we have to regulate how we educate our students and residents and how to use it appropriately.
So your emphasis is that AI is a tool that can help us, but you should still trust your healthcare professionals.
Yes.
So does this expansion overall excite you, or do you think it's a little bit scary to see where it can go?
It's really excites me. I think it's going to benefit the healthcare system. It's going to cut costs. It's going to prevent progression of chronic disease. It's going to probably end up with patients having more healthy lifestyles and hopefully living longer as well, while they're still healthy.
Well, thank you so much for being here, Dr. Elsayed.
It's my pleasure. Thank you.